Ursula von der Leyen, President of the European Council, just to fill me in on the plans that the European Union has to restrict travel by non-EU citizens outside the Schengen area, and that's developing throughout the course of the day. There will be a video conference tomorrow of the heads of state and government of the 27 member states, including me, and that will focus on EU-wide cooperation, on any travel restrictions, and also on the economic impact of Covid-19, which is going to be considerable. I think we all realise that at this stage. There was a meeting of NEFIT, which the CMO was at, and he might speak about that later at his press conference, and also a meeting of the Cabinet Subcommittee on Covid-19, after which I briefed the party leaders on the outcome of that Cabinet Committee. In terms of the Cabinet Committee itself, we received an update from the Chief Medical Officer, including modelling and projections on how Covid-19 is going to develop over the next couple of days and weeks. I think everyone will understand at this stage that there will be an exponential increase in the number of cases in the coming days and weeks, increases of roughly 30% in the number of cases every day. That is inevitable. That cannot be stopped. We're at the very start of that curve that people are starting to become familiar with. So there will be a very significant increase in the number of cases every day for the next couple of weeks. The objective is to flatten the curve, but it's only possible to flatten the curve in a few weeks' time. So no matter what we do now, or no matter what we could do, that curve has to rise exponentially before it can level off. But the objective is to make it level off. In terms of what we're stepping up, we're doing what has been proven to be the most effective, particularly in places like Singapore and South Korea, in parts of China beyond the Wuhan and Hebei province, and that is increasing testing, and community testing is now underway, really focusing on contact tracing and also getting the message out there about social distancing and the advantages of doing that. So that's what we know seems to work best, at least in Asia, and that's what we're focusing on, testing, contact tracing, and also social distancing. We had an update as well from the Chief Executive Officer of the HSE, who just filled us in on the massive progress that the HSE has been making in the last couple of days, doing in a weekend the kind of things that might have taken months to do in the past. And I really want to thank the HSE staff and the HSE at all levels and all places for the phenomenal work that they've been doing in the last couple of weeks. There's a particular focus today on making sure that contracts were signed for personal protective equipment for our healthcare staff. That's being done, and some arrangements are being made to procure that, some from Europe, some from China, making sure that our healthcare staff will have the personal protective equipment they need to minimise the chance of them getting infected with Covid-19. And we know from Italy and China and other places that one of the really tragic consequences of Covid-19 is doctors, nurses and other healthcare staff getting infected. So we need the PPE to protect them, and we have a lot already, but even more is now on the way. And also we've secured the procurement of more ventilators. We know that Covid-19 causes a lot of people to be hospitalised. It's a mild illness for most people, but for a significant minority, they need to be hospitalised, and a significant minority of them have to be ventilated. So we have hundreds of ventilators already, hundreds more have been secured, and we'll get more every week so that we can maximise the capacity to ventilate patients if they need to be ventilated. But we cannot say at this stage whether the number of people who need to be ventilated will exceed the number of ventilators that we have, and unfortunately no country can determine that at the moment. Also approved Ireland's national plan in response to Covid-19. That will be published in the next few moments if it hasn't been already, and that just sets out a framework for how we're going to deal with this emergency over the next couple of weeks and couple of months in all the different sectors, ranging from banking to healthcare to social protection, to you name it. There is going to be a renewed focus on communications. Covid-19 is more than a health issue. It's affecting the economy and society in so many different ways. So there's a responsibility on us as government to make sure that the public gets the right messages and the truth. And we know there's been a fair bit of fake news and fake expertise and false facts out there in the last couple of weeks. We know we have a responsibility to make sure that people get lots of information and accurate information. And I know that you as the professional media are going to help us in that regard, and we've probably never needed professional public service orientation media more than we have at the moment. We discussed the legislation, which will be published tomorrow and will go to the Dáil hopefully on Thursday, and that is special legislation around social welfare and health. You'll be familiar with what we're trying to do in social welfare to make sure that people get unemployment benefit right away, job seekers benefit and job seekers assistance right away, and also that people get this special sick pay payment for those who are asked to self-isolate for 2 weeks. So that legislation will go through on Thursday, and also there's public health legislation attached to that as well. The powers that we have under the Health Act of 1947 are already extensive, but they will need to be added to now to enable the state to close mass gatherings, close venues if needed with the force of law, and also to enable the state to detain people if they have to be detained on public health grounds. Legislation we hope we don't have to use, but legislation we feel that we need to have. Then finally, we had a discussion on the economic impacts on Covid-19, which are going to be serious. The economy is going to slow down dramatically. That's happening already, and it will contract. I'm confident that we will bounce back and bounce back quickly, but there will be significant consequences already. Unfortunately, lots of people losing their jobs and quite a number of businesses closing. So our first priority, of course, will be to make sure that those people who've lost their jobs get the social protection that they need and they're entitled to. And when we get through this, to make sure that we prioritise getting all those people back to work and saving businesses that are viable and can be reopened again in a few weeks or a few months' time. Although that won't be the case for all businesses, I think we realise. Also, a lot of issues coming up around, for example, mortgages and loans. Mr Donoghue will meet with the banks to see what can be done to allow people to defer payments of mortgages and loans. We understand that there will be people who will find all of a sudden that they're out of work or their income has been dramatically reduced, and therefore they or their business will struggle to pay mortgages and loans. So we will be seeking forbearance from the banks so that those payments can be added to the end of their mortgage term or loan term. Having said that, though, it's still the case that there are nearly 2 million people in the economy who are working. There are lots of businesses that are still doing well, and it's really important that people who can pay their mortgages, who can pay their bills, who can pay their loans, do exactly that, so that we can focus our resources on helping those who can't, helping those who need that help. And also looking at the particular issue around rent and people who may find themselves unable to pay their rent in the next period ahead. And Mr Murphy is working on that, and we should have some solutions on that later on the week. And also in relation to the issue of providing childcare for healthcare staff so that they can work, and we should have a solution on that in the next few days as well. So I'll hand you over to Donald.
Yeah, thank you. I'm just going to deal with the travel issue. Over the last number of days, we've been trying to give travel advice to travellers going to different parts of the world and different parts of the European Union, trying to distinguish between countries. That is becoming increasingly difficult and complex now in terms of differentiating from a health perspective between different EU countries, never mind countries in other parts of the world, because of the rapid pace of the spread of the virus in different parts of the world and different parts of the EU. So our travel advice now is very clear. And as of this evening, we are advising against all non-essential travel overseas from Ireland. That is going to last until at least the 29th of March. That includes to the UK, but obviously not Northern Ireland. And we are also going to be imposing restrictions on everybody who comes into Ireland from now on. We are going to be asking them essentially to restrict their movement, and when they land in Dublin Airport or Cork Airport or Shannon Airport or elsewhere, they will be given clear instruction in terms of what that means. It's not quite self-isolation, but it certainly involves significant restrictions in terms of people's movements for up to 2 weeks. So that is a simplification and a change in the travel advice. It's based on what we're seeing across the European Union in particular, where different countries are taking unilateral action that in some cases is resulting in the closure of airports, but certainly significant restrictions on movement and we don't want Irish people to be stranded in different parts of the world and different parts of the EU, unable to get home. But it is also based on good public health advice. And the NEFIT met this morning, and they have given me very clear advice in relation to travel overseas. And their recommendation is very clear now in terms of the public health concerns about non-essential travel overseas. And that is also reinforcing the decision that we're making. The other point I'd make is that we are making good progress with airlines in relation to trying to bring people home from Spain in particular. There's about 20,000 Irish people in Spain, holiday makers that want to come home. Ryanair, I think, ran about 16 flights today. Aer Lingus also had a busy schedule. And while there have been some problems in terms of people booking and rebooking, by and large, we are bringing large numbers of people home now, many of whom had planned to come home in a week or two's time. And those efforts will continue throughout the week. We did set a deadline yesterday of trying to bring everybody home who wants to come home from Spain by midnight on Thursday. I think in reality you will certainly see Aer Lingus operating flights on Friday and Saturday, and that's okay too. But we want to make as much progress as we can by midnight on Thursday to ensure that people who want to come home can do. And the airlines have given me a commitment that they will ensure that they have the capacity to be able to do that. And also that they will ensure that it's not going to cost people unduly to come home on the flights that are being put on to do that. So they're the two travel updates from today.
Well, thanks very much. We promised people at the outset of this global pandemic that we would provide them with truthful, accurate information on all of the steps that government is taking. So this evening we'll be publishing the letter I received from the Chief Medical Officer, in line with what we also did last week. This is a summary of the meeting that took place at the National Public Health Emergency Team today and the 10 decisions that they made at their meetings. Most of the decisions are technical decisions that relate to the workings of the HSE. 3 of the decisions relate, as the Taoiseach has outlined, to the issue of non-essential travel overseas. And then it also refers to the fact that they've begun considering a proposal on the provision of emergency childcare for essential healthcare staff. We've got to make sure during this situation, which may go on for quite a time, that we can still get our nurses, our doctors and other healthcare professionals and indeed other essential workers to the workplace, and that their children can be well minded during that time. So we'll publish that letter so the Irish people can see exactly what we're doing and they don't need to rely on WhatsApp messages or anything else to second guess the actions or the advice of the Chief Medical Officer and the National Public Health Emergency Team. I want to sincerely thank the thousands upon thousands of people who worked flat out over the weekend in the Irish Health Service, in the HSE, in the Department of Health, in our hospitals, in our primary care, in our social care, looking after older people, looking after vulnerable people, our GPs who were absolutely inundated at the weekend and rose to that challenge with their usual can-do attitude in a very difficult environment. I want to thank people across all government departments and state agencies. As the Taoiseach rightly said, maybe more was achieved this weekend than that would generally be gotten done in many months. That was the pace at which people worked. Such is the seriousness with which everyone is taking this national and global challenge. So our sincere thanks to each and every one of those people. They're making massive sacrifices, not just personal sacrifices, but sacrifices in terms of their family time, and they're doing it to keep us all safe and to keep us well. Today the government heard at our Cabinet Committee from the Chief Executive Officer of the HSE about how they intend to scale up the health service. And I think we've got to be truthful with people. We don't know exactly how many cases we're going to see in this country. We've seen some of the best developed health services in the world experience real challenges from this pandemic. But I want people to know that we heard very clearly and we've seen very clearly that the HSE is doing and will do everything it possibly can to expand the size of the Irish Health Service and to reorientate it so that it can deliver care for sick people. Tomorrow, for example, we will launch a massive national recruitment campaign. We will hire everybody that we can to work in the Irish Health Service for this pandemic. So if you're a nurse that's maybe retired a few years, or a doctor who's retired a few years, or a healthcare professional and you want to come back, we need you. We want you. Your country needs you. If you're somebody who's been working part-time hours and are now willing for the next few weeks and months to put your shoulder to the wheel and take on full-time work, we need you and we want you. If you're a student who has yet to finish your studies but you have a skill set and we can deploy them, be it as a healthcare assistant, a nurse, a student doctor or whatever else, we need you. We want you. So tomorrow the national recruitment campaign will be launched in earnest, and the only limiting factor will be the availability of people, not resources. The government, led by the Taoiseach's instruction, has been very clear on this. Anybody that can be hired will be hired, and I make an appeal to people right across this country tonight, as I know they will, to step up to that challenge. We're also, as you know, significantly expanding community testing. And let's remember, only a few short weeks ago, we were only testing people who came back from certain regions of the world, effectively people who were on holidays in northern Italy originally, or people who were in China. In recent days, we've expanded the grounds for testing. We're now testing people on the basis of symptoms and not geography. That means many, 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 many more people are coming forward for tests. And this is a good thing, and we thank them for doing that. In the countries where we've seen progress made in flattening the curve over a period of time, it has been because, as the chief of the World Health Organization said today, because we test. We need to find more of this virus, isolate people with the virus, and contact trace anybody who's come into contact with them. That is how we will deal with this from a public health perspective. But that is going to mean people being patient with us. It's going to mean we don't need 4,500 people ringing 999 like they did over the weekend looking for a test for COVID-19. That's not how you get a test. If you have the symptoms, you contact your GP by phone. Your GP will book, if they believe it's appropriate, for you to have a test at one of our testing centres around the country. Today we've also agreed more supports for our GPs as well, and all of this will be outlined in our action plan. But my message tonight, and it's a serious one, is that this is not just a whole of government effort. I hope the Irish people can see that there is a whole of government effort. Everyone is working as hard as they possibly can. But we need a whole of society effort. We need a national effort. Perhaps I think sometimes that there is this false hope in our country that measures can be taken by government that will vanish this problem away. That's not true, and we shouldn't make that presumption. This pandemic cannot be wished away. It's going to have a real impact on our people, and many, many of our people, many families and all communities. And early interventions by government, decisive action by government is really important, and we haven't been found wanting in that regard. But it won't be enough. It will not be enough, because each and every single one of us has a role to play, and our success will be dependent on how we as people decide to step up to that challenge. The numbers of cases of COVID-19 is going to continue to rise and rise and rise in the coming days. But if we follow the public health advice and put our shoulder to the wheel, we can try in the coming weeks to flatten that curve. And that really is our national challenge. We've seen over the last couple of days and weeks people really practice the hand hygiene. We've all stopped shaking hands. We're all sitting here in a much more civilised environment tonight than perhaps we usually meet. We're bigger distance between our podiums. We're coughing into our elbow and not into our hand. We're disposing of our tissues. We've learnt a lot as a people in recent days and weeks, and we need to keep that going. But we need to get the social distancing piece right. And it's really simple. You should be keeping, ideally, 2 metres between yourself and other people at all times. That's what we're trying to achieve. So if we can put as much effort into getting the social distancing message out now in the coming hours and days as we have into the hand hygiene and cough etiquette message, I think we can make a real difference. So we need everybody in this country to step up. And if we do, it's our best chance of keeping our people well. Mr. Humphreys.
Okay, thank you. Good evening, everyone. As you have heard, we have discussed a number of issues at the Cabinet Subcommittee. My focus continues to be on businesses, and in that regard, I welcome the streamlined system for unemployment payments for workers impacted by COVID-19 announced by the Department of Employment and Social Protection. Obviously, the last 24 hours have been very difficult for the people working in our pubs and bars who have lost their jobs overnight. The government's immediate concern is that they get the necessary income support through job seekers benefit, and I want to thank those employers who are working closely with the DEASP to ease the administrative pressure by paying their staff the equivalent of job seekers, and of course that is fully refundable. In the past, those who were self-employed were not entitled to job seekers, but due to the changes made in the last budget, they now qualify for job seekers benefit. And I know that this news will be a relief to many small business owners who have had to close their doors. In terms of the retail sector, I want to thank the frontline staff who have worked extremely hard to keep the shelves stocked over the past number of days. They are critical to our supply chain, as are the many lorry drivers who leave their families on a Sunday evening and travel across the continent to ensure that we have the products that we need. So they are essential workers and they do deserve our respect and thanks. I continue to work closely with all the different stakeholders through my department's Enterprise Forum, the Retail Consultation Group, which includes the food distributors and the multiples. What continues to be clear is that access to cash flow is going to be vital to our businesses, and in that regard we have the €200 million SBCI working capital facility, the Microfinance Ireland loans up to €50,000 and the credit guarantee scheme up to €1 million. I've met the pillar banks last week who have assured me that they will work with their customers and give flexibility in terms of loan repayments and working capital facilities. We have a dedicated phone line set up in my department to give information and guidance to businesses. I continue to engage with the agencies in my department, and we are keeping all supports under review to ensure that we can respond to the needs of businesses.
Thanks very much, Taoiseach and Minister. So now going to questions. We've got just a few minutes for this. So we're going to kick off with Paul Cunningham, then Gavin Riley, then Jennifer Bray.
Taoiseach, can I ask you, what is non-essential travel? And given this is government advice, what do you respond if your definition of non-essential travel differs from many people in the public? And Taoiseach, if I could ask you just about what message do you have to people who have lost their jobs? We believe at least 140,000 and more to come. What simple message do you have for them tonight? Thank you.
Yeah, first of all, I think it's important to say that we are going to ensure that arrangements are in place to protect key supply chains in and out of Ireland, by air and by sea. And so that means hauliers, pilots, marine professionals and servicemen and so on, who are operating those supply chains, the kind of people that Heather referred to earlier, that are driving trucks to the continent and back, bringing goods into this country every single day. And don't forget that even if you look at Northern Ireland, about 50% of the goods that end up in Northern Ireland come through Dublin port as well. So those supply chains are important and we need to maintain them. And we regard that as essential travel. But non-essential travel effectively means people who are choosing to go overseas and don't need to. They shouldn't be doing it. That's now our clear health advice and also travel advice, for the reasons that I outlined earlier, which is that we can't be sure they can get back, because we think that there's going to be enormous disruption in the days ahead to air transportation across the European Union. We're hearing that from people like Michael O'Leary this morning, but also many other airlines as well, talking about grounding a large portion of their fleets in the coming days and weeks. And we're also seeing other EU countries closing borders, closing airports, and not facilitating air transport in and out. So we will focus on key supply chains, both by sea and by air, and facilitating the people that are involved in that transportation. But really what we're saying is, outside of that, non-essential travel shouldn't be happening to and from this island. And that is so that we can keep people safe and so that we don't find Irish people stranded in different parts of the world.
I think to the tens of thousands of people who've lost their jobs in the last few days, all I can do at the outset is express my profound sorrow. I doubt anyone a few weeks ago thought that it would come to this, that tens of thousands of people would be laid off, that we'd see unemployment rise again in this country, which hasn't happened in 13 or 14 years. I want to say to people who have lost their jobs, that social welfare income support is going to be there for you, whether you're employed or self-employed. It will be there for you and also for your dependents. that there are other sectors in the economy and society that are hiring, particularly in areas like health and social care. So if you have skills in those areas, we need you, and we want you to take up those positions in the public service and outside of it. If you have those skills and qualifications, there's a good chance we're going to have a job for you. But if you can't find another job in the next few months, once this emergency is over and we start to deal with the aftermath and start to put our economy back on track again, our first priority will be assisting those who've lost their jobs to get new jobs and enabling those businesses that are viable and can reopen to reopen. And also that ministers and the government will be working really hard over the next few days to help out with some of those issues that people are going to face, not being able to pay their mortgage, having loans they have to repay, rent. All of those things are being worked on at the moment so that we can put in place arrangements for forbearance so that people don't have to pay those bills and can wait until they get back to work before they do.
Next up is Gavin Riley. Can I just ask one question per person, please, and that way we can get around the room. Thanks.
Okay. Taoiseach, can you give us a little bit more guidance on the other powers that might be included in this emergency legislation that's been brought forward on Thursday? We know that the provisions of the health factor are also already quite robust, so what other provisions do you think are necessary? And also, with just brief reference to the mention that we don't know how many cases there may be, is there even any rough modelling at this point to suggest what the upper ceiling or the lower floor might be in the number of cases that we could have in this jurisdiction?
Yeah, I think we have to be careful about the modelling because it's early days yet, and I think Tony is probably going to talk about that in more detail at his press conference later, but we do have modelling now, at least for the next week or so. But the kind of figures that people have suggested, that around half the population getting COVID-19 is accurate. That could certainly happen. For most people, a very mild illness, for some, a very serious one. And the objective really is to make sure that that's spread out over the next few months and doesn't all happen over the course of 1 or 2 weeks. And I think that's a difficult thing to explain to people. There is an inevitability to this. The number of people who have COVID-19 will continue to rise every day, every week for a couple of weeks. But the objective in a couple of weeks' time is to flatten the curve then, so that we don't have a single spike at the same time that would overwhelm our health service. But the total number of cases will be very, very high. The objective is not to do the impossible, which is to stop that, but rather to spread it over a longer period of time so that we can manage it better and make sure that our health service is not overwhelmed. In the legislation that's being published tomorrow and will go to the Dáil on Thursday with the cooperation of the opposition, I believe we'll have that, really is 2 parts. One part is social welfare related, so that's the special illness benefit for people who are off sick because of COVID. And also on the health side, gives the Minister for Health very specific powers for the purposes of COVID-19 only. They can't be used for anything else or any other issue or public health emergency, and that is to prohibit some events and mass gatherings, to impose travel restrictions, and also enabling us to detain and isolate people who are a possible source of COVID-19 if they do not submit to voluntary self-isolation.
Okay, Jennifer Bray, then Shane Beattie, then Craig Hughes.
Taoiseach, you mentioned a figure of 30% day-by-day growth. That would be 10,000 cases in 2 weeks. Where will these patients be treated? Because clearly there's the capacity in the health service. Are you considering maybe requisitioning or commandeering assets, hotels, private healthcare facilities? And could we just get an update on the restaurant situation as well, please?
Okay, well, first of all, on the, your maths isn't far off. We would expect that, by the end of the month there'll be maybe 15,000 people will have tested positive for COVID-19. But again, to emphasise, most of those won't need any treatment. Most people will be well and they'll be treated at home. And the most important thing is that they stay at home for the 14 days so they don't infect other people. So most of those people will need little or no treatment other than fluids and paracetamol, and maybe not even that. But a percentage will need to be hospitalised, and a smaller percentage of those again may need critical care or ICU, and that's the focus, and that's why we're looking at things like space in the private hospitals. Also, as you mentioned, using hotels, using other public facilities to expand both the capacity of our health service, the number of beds, and also the equipment that we need for those who may need ventilation. But it's really important to emphasise that yes, there will be tens of thousands of cases, maybe hundreds of thousands, perhaps millions, but the vast majority of those will not need treatment, will not need hospitalisation, but some will, and we need to make sure that it doesn't all happen at the same time, and that's what flattening the curve is about. It's not an absolute thing. It's not about locking down the country tomorrow, shutting it down and stopping the virus spreading. That's not possible, and we know that's not what's happened in Italy. But what is possible is to reduce the number of social interactions considerably, and therefore slow the progress of the virus, and therefore flatten the curve. And I think I tweeted a Washington Post thing today, which I'd encourage you to look at, explains very well why quarantine isn't the right strategy, but the right strategy is social distancing, which is not to eliminate all social contact, but to reduce it very considerably, so that the virus spreads, but spreads much more slowly. I think, Tony, do you want to maybe come in that?
So we're anxious to, we've provided guidance in relation to social distancing. We're anxious to help and work with any particular sector around the interpretation and the application of that to any particular sector. We haven't changed or updated that guidance. We know that, for example, in relation to the pubs and clubs, they came to us to say they understood the guidance and its implications, and their view was that they would not be able to implement that guidance in pub environments, and it was on that basis that they felt they couldn't, because they couldn't comply, that we asked that they would close. We'll continue to work with other sectors to try to help them to understand how the application of our guidance in relation to their sectors can be applied in a consistent way. And what might be possible in some sectors or in some particular establishments might be difficult in others. And so we want to recognise that. We also want to recognise that in broad public health terms, if you think about restaurants, for example, they provide a very important social service. They provide a very important public service. And restaurants feed a substantial portion of the population every day of the week. And we want to recognise that. But there are ways in which they provide some of those services that might have to be adapted and updated to allow the social distancing guidance that we've issued to be effectively implemented. And we're anxious to work with them or anybody else or any other national organisation in terms of the interpretation of the guidance that we've already provided, so we can achieve the things that Taoiseach is outlining.
Taoiseach, could I just ask you about this idea of a mortgage holiday for a lot of those workers who are in difficulties now and with what's going on? Is there anything more you can do with the banks if they don't play ball on this?
Well, I don't think anyone would ever describe not being able to pay their mortgage as being a holiday, but I understand the question that you're asking. So Mr. Donoghue is engaging with the banks. The solution may well be allowing people who cannot pay their mortgage, and there will be tens of thousands of people who will not be able to pay their mortgage or pay back loans or pay the rent over the next couple of months, allowing them essentially not to have to pay that mortgage for those months until things recover, and then they'll be able to pay that mortgage, be added to the term, if you like, at the end of their mortgage. And banks can do that. It's been done before. They can do it again. We're confident that can be done. But Mr. Donoghue will be able to give you more information on that later in the week. But I do think it is important to emphasise that we have to act collectively here. We are all in this together. It may be the case that there will be 100,000, maybe even more than that, people unemployed over the next couple of weeks, people who can't pay their mortgages. There will still be 1 million who can. And those of us who can should continue to do so, because we need to target our support and our efforts on those who can't, and that's a really important message, I think, for the public. And the same goes for businesses too.
The issue of restaurants was touched on there. Some people within that sector have even called for restaurants to be shut down temporarily. Are we going to see that? And do you envisage us dealing with coronavirus into next year?
When it comes to any of these issues, and restaurants is one of them, we will always act on the advice of the public health professionals. And if the public health professionals tell us the restaurants should be closed, well, then that's something we will do. But that's not what they're saying at the moment. They're saying that restaurants actually have an important function. And I know some restaurants have decided to close. That is their decision. Others have decided to adapt. They're providing a takeaway service. They're providing a collection service. And in some cases, I understand some have been able to operate social distancing, spreading tables out and so on. And again, we really want people not to get the wrong message here. The whole idea around social distancing is reducing the number of social contacts and therefore reducing the spread of the virus. Most people who got COVID-19 in China, for example, got it in their own homes because that's where people tend to pass on viruses to each other. So we're missing the message if we think that the solution is to ban flights or to close a restaurant or close a hairdressers and so on, and then people go home and do exactly what they would have done in the restaurant or exactly what they would have done in the hairdressers. You know, we're totally missing the point if people are fixating on particular types of businesses. Most people who get COVID-19 will get it in their home from their family or they will get it from close contacts with their friends. And that's why all of those rules around social distancing, the 2-metre distance, the hand washing, the sneezing, the coughing, all of that applies even more so in your own home, your own workplace and among your friends than it does in any business you could possibly mention. I don't know. Nobody can predict this. Nobody heard of this virus 13 weeks ago, so nobody can predict that. But I definitely think we're going to be dealing with this for months, not weeks. I know we've set that date there of March 29th, but that's giving us some time to see how things develop. I'm certain we'll be dealing with this for many months. Whether it's an issue next year or not, I can't say.
Taoiseach, I suppose people listening at home will now start to think about, right, if the cases are going to increase significantly in the coming weeks, where are those cases? Where should I not be going? I mean, we're talking about responsibility, staying in your home, trying to limit contact, but if we talk about clusters, and maybe Mr. Hoolan might come in this as well, will the government, will authorities start to reveal, as they have in Asian countries, more exact locations or maybe counties where there are surges? And if I may, just in terms of the all-Ireland approach, there's obviously been some significant debate about the differences across the border. You've asked for people to restrict their travel abroad. Does that include going across the border? Thank you.
I might give travel to Taoiseach and the issue on clusters and so on to the CMO.
So you're right to ask the question in the sense that this is a disease that behaves in a clustering way. We've already made clear that as the number of cases increases and we're getting close to the point and we can preserve, as we've wanted it from the outset, the confidentiality and privacy of individuals, that reporting cases by county is something we want to do, and that'll give people a greater sense of the distribution of cases around the country than we've done so far. Part of the reason we reported for now in the way that we've done is to preserve that anonymity and privacy. And the measures that then we need to take will be informed by the distribution. It is a disease that clusters, you're right to say. If I might also just contribute to the start of the question in relation to travel, the practical implications of travelling across the border are such that they're different to travelling outside of the island. It's almost impossible to maintain social distancing requirements while travelling off the island, whereas you can do that quite easily on the island, travelling inland, on land across the border. And that's part of the reason why we treat Northern Ireland differently to here in terms of our travel advice.
Yeah, I mean, just to say we will continue to protect the right of people to move on this island north and south, and of course we will continue to talk to political parties in Northern Ireland. I spoke to the Secretary of State for Northern Ireland today in relation to the different approaches to this challenge north and south of the border. That is causing some tension in terms of politics within the executive. That's plain to see. And so we want to try and work on that issue in the days ahead, because we have an awful lot in common on both sides of the border. We have the same objective, which is to protect vulnerable people, to slow the spread of this virus, and to ensure that we take public health advice in terms of all the political decisions that are implemented. But there is going to need to be continued engagement here with the executive in Northern Ireland, but also with the British government, and we've been quite active on that front today, and that will continue for the rest of the week.
Okay, thanks very much for that.
Thanks, everyone.